For most, access to quality health care is an assumption in our society. However, rural towns face unique challenges that require the collaboration of a community, volunteers, donors, and a devoted team with a passion to provide a higher standard of care for all of those in need. We are Pagosa Springs Medical Center, and this is our story.
Mary Fisher came in here in 1895 and served until her last day, which was 1928. She came on a horse with a mule behind her with all of her possessions over East Fork down to Pagosa Springs and stayed. She was known as the mother of the community and the angel of the San Juan. So she was a very well-beloved person in this area.
We got a hospital in town now, and it's really, really neat for a community this size. But when I came here in '94, there was like 2 doctor's offices. One down here downtown with nurse practitioner Susan Kuhn and Dr. Mark Wienpaul, and then one up near where the medical campus is now with Dr. Jim Pruitt, and EMS, Emergency Medical Services, and that was it. And it was that was it, and there was one stoplight. And now it's not that way, as you can see.
We built our home in '77, but we couldn't move up full-time till '87 because we weren't old enough. But we came up 2 or 3 times a year to visit our house. So we had been skiing. It was in the spring in April, and sure enough, I had a skiing accident and fractured. It was a twist fracture, tib fib, my left leg. Well, the nearest ambulance service to the ski area at that time was Del Norte. So the ambulance came from over there, picked me up, took me to Del Norte, and they x-rayed it and diagnosed the problem, and then informed me that the surgeon over there does not care for anyone who doesn't live in the valley. So the best thing they could do was give me a cardboard splint. So think about it today. If that happens now, I don't care where you're from. We don't care where you're from. If you need care, you get it right here in Pagosa, because we can give it to you.
I'm Dr. Bob Brown. I've been in Pagosa for 22 years at the medical center since it opened 9 years ago. I think it was 2008 we opened up. At that time I had a private practice in town that we'd been doing for 5 or 6 years, I think. It used to be an old joke that we've had this entity called the Upper San Juan Hospital District, and it was a bit of a joke because nobody thought we'd ever build a hospital. And so they subsequently changed the name to the Upper San Juan Health Services District, and within a few years of that, we actually did build the medical center. I think it came as a surprise to a lot of people. It was something that a lot of people wanted, felt was needed, but in many ways, people here had just gotten used to the idea. If you need to go to the hospital, you go 60 miles down the road to Durango, and they'll take care of you there. But a lot of people put in hundreds and hundreds of volunteer hours to make this thing happen, and it's grown beyond what I think anybody ever thought it would. Initially, it was pretty bare bones. We had some x-ray capabilities, no surgical capabilities, small inpatient wing, an ER, and that was about it. And see what it has become, especially with the opening of the the new outpatient services building. It's been amazing to be a spectator as well as a participant.
Hi, I'm Delia, and I work in environmental services at Pagosa Springs Medical Center. I like the exercise I get from all the activity. It is rewarding too, even if it's something small like helping a patient find their way to where they need to go.
Hi, I'm Angela Archibald, Registration Lead at Pagosa Springs Medical Center. I enjoy people. I enjoy helping our patients receive the treatment they need and being a part of the community. We have been in Pagosa Springs for 13 years, and my family has benefited greatly from the evolution of healthcare here. I remember the days of driving long distances to get the kids care when they were sick. Now I can bring them to Pagosa Springs Medical Center and have them seen by a coworker and friend. That's something special. That's something you won't get in every town.
Hi, my name is Connie Cook, and I'm the Assistant Chief of Finance for the Pagosa Springs EMS. In the 10 years that I've been with the organization, I've watched it grow into a strong family. It's the people that have brought me back twice. This is home. We do excellent work, and there's nowhere else I would rather show up every morning.
Hi, my name is Dr. Bill Webb. I'm a board-certified orthopedic surgeon that's been practicing for more than 20 years. Over the course of my career, I've served as a team physician for multiple high school, college, and professional teams. I believe there's a significant reward found in working with the local community and helping our patients get back to enjoying the activities they love to do. I was fortunate enough to arrive in Pagosa at a time when the community needs for orthopedic surgery had reached the point that the hospital decided to add the service. Admittedly, it was the allure of the breathtaking San Juan Mountains and opportunities to escape in the Colorado outdoors that first attracted my wife Rhonda and me to Pagosa Springs. However, it has been the people and a strong sense of pride that exists that has kept us here as providers and engaged members of the community.
I'm Bruce Young, and I got diagnosed in January of 2011 with colon rectal cancer with the Pagosa Springs Medical Center. They've been my care providers ever since. I ended up having to do radiation and chemotherapy. And then I ended up having a colostomy surgery. And things were pretty good until 1 year to the day later, I went in for a liver surgery with the cancer moving to the liver. Stayed in that hospital in Porter for 3.5 months. Come back, and hospital here saved my life 3 days after coming back from the first surgery in Porter and flew me back down. The sepsis team and everybody was excellent at that time. I was just totally the best. The care there has been great. The bookkeepers, everybody setting up and helping me with every aspect of the whole scary situation has been beautiful.
My name is Sandy Courtois, and I am a new resident in Pagosa for about 2.5 years. I'm a retired registered nurse, and when I first moved to Pagosa, the first winter I was here, I ended up getting the flu that went into pneumonia. I had no physician, knew no one, so I came to the emergency room, and I was treated so well there. And I felt that the physicians and the people that worked in there were just overwhelmingly nice. They made me feel like I was the only person there. Took really good care of me. And as a nurse, I'm very judgmental. And it just stuck with me that whenever I wanted to volunteer here, I would like to volunteer at the hospital.
I think unequivocally you can say the hospital has been instrumental in the growth of this community. We know for a fact that a lot of our residents, second homeowners becoming full-timers or retirees relocating, those demographics require a lot of services the hospital provides. And we know they would have chosen different markets if it weren't for the hospital.
My name is Evelyn Tennyson, and I'm a resident of Pagosa Springs. My husband and I built a house here in 2009. We had been traveling to Pagosa for probably close to 20 years before we decided that we were going to build our house here. Since moving to Pagosa as a part-time resident, hopefully one day we'll be full-time residents, but one of my real heartfelt community involvements is probably with the Pagosa Springs Medical Center. That was one of the main reasons why we chose Pagosa Springs to move here. We looked at Durango. We were afraid that maybe Pagosa didn't have a hospital big enough for us at the time. And then we got to thinking, after talking to people here, we have several friends that were involved in volunteering. We have friends that were involved in being on the board at one time. After speaking with them, we found out that the hospital had big plans, and we wanted to be involved in those big plans with the hospital. So we have done everything that we can do to get involved in the hospital, and we want to encourage everybody that's in this community to get involved one way or the other, whether it's donating an hour of your time to this community and getting involved in the hospital. It doesn't necessarily have to be monetary. If you can do monetary, that's awesome. It doesn't matter. It can be $1, it can be $1 million, whatever you can give. Give your time if that's all that you can give, because we can attract a lot of wonderful doctors and nurses to this community, but we need to show them that we're also committed to this community and to the hospital and to everything that we have to offer here. So I'd like to encourage you to do what you can to support our community.
Hi, my name is Mary Jo Houlihan, and I'm the Executive Director of the Chamber of Commerce here in Pagosa Springs. I've been in Pagosa about 23 years, and I moved here and started my own business, and then I've been Director of the Chamber for about 11 years. In my 23 years here, I've seen a lot of growth. One of the things that I find exciting about the growth in Pagosa is our hospital. Step by step, the hospital's been growing, and now we have this phenomenal expansion, and it has changed the look and the feel of our community.
Hi, I'm Beth Felty, the Director of Surgical Services at Pagosa Springs Medical Center. My husband and I moved here about 18 months ago to have a better work-life balance, and we love it here in Pagosa. So the reason we give back to the community is because we feel like the community gives to us through having a job, and that supports my family. So we just feel like we should support the hospital and its mission, and we want to help make things better for our patients, the doctors, and the families here in Pagosa.
Hi, I'm Jody Scarpa. I work with the Foundation for the Pagosa Springs Medical Center. We are a nonprofit entity that was established in 1997 to exist solely to provide support for our mission and vision. It is the place to honor the past and inspire the future. It is the place for long-term thinking, planning, and acting in the best interests of PSMC and our community. It is the place for gathering donations from the community donors and grantors and employees. It is the place to gift endowments to memorialize our families. It is the place for our volunteers to give of themselves. Our foundation is the place where we are grateful for everyone who makes healthcare available where we live. The story keeps getting told and more people keep getting involved, which is not only better, it is what makes us Pagosa Springs Medical Center.
Helping out our patients makes us better.
Always in service makes us better.
Providing the services our town needs is better.
More access and personal care is better.
Getting care from a friend or neighbor is better.
Supporting the community that supports us is better.
Helping a friend in the community is better.